Grief is something that is universal. Grief is something that all of us at one time or another in our lives that we will experience. It is projected that we will all encounter grief. It may be from the death of a loved one, the loss of a job, the end of a relationship, or any other change that alters our lives as we know it. It has been projected by some that there will be a grief pandemic, and that this grief pandemic will be all throughout the United States, and that all Americans or Americans in general for years to come will have to deal with the effects of this grief pandemic. Here this afternoon to discuss this topic of grief, we have Dr. Pitts. Dr. Pitts, ED, D in education, MS, guidance, and counseling. We also have Pastor Ralph Ford, Grief Share Facilitator. Welcome to The Awakening.
Thank you.
I want to thank you both for being here. This is a difficult topic, and it's especially difficult, can be difficult, because I know that you both have a story. You both have something you've been through. We will start with Dr. Pitt. Tell us how you came about to work as a profession and also to minister with this grief, with people who are grieving.
I initially was a physical therapist working in acute care and in home health for many years. And it didn't take me long to start realizing that even when people have physical problems, that they really have issues with their mental outlook. And so as I became older and I started working at the university teaching in the School of Physical Therapy, I also decided that I wanted to go into really researching a little bit more about how the mind, how our thinking can affect our recovery, even in the physical realm. And so that led me to getting both my master's and my EDD in education, teaching at the university.
Presently do.
I am a full-time clinician in guidance and counseling. And I have my own practice, and I do a complete range of pediatric to geriatric, from general counseling to more involved counseling with depression and anxiety probably being the major diagnoses that I see. And then also with grief management, especially following the pandemic, the COVID-19 pandemic.
Okay, and Pastor Ford?
Mm-hmm. How would you repeat the question so I can make sure I stay on the task?
How is it that you, in your profession and also personally, how did you come to work with and minister to those who are grieving?
Well, that's an interesting question. I had never thought that I would be working with people or ministering with people dealing with grief. It was out of my own experience in losing my wife to cancer 4 years ago that I initially got into the support group called Grief Share. And going through it 2 or 3 times, there are 13 cycles are 13 topics in a cycle. And after going through that, I just began to ask the Lord, how can I help other people that are dealing with grief because of a loss? I wanted to use the comfort that I had received in comforting others and as the Word of God tells us to do. And so that's how I got into facilitating Grief Share. I started co-facilitating with someone else, and then I started doing it myself. And it has been a blessing to me and others as we continue on this journey, healing journey, dealing with grief.
Okay, and I'm sorry about your loss. And beginning with you, Pastor Ford, what exactly is grief?
Grief basically is a loss. I like what someone coined, and I don't know the author of it, but they said that grief is love with nowhere to go. And that's the thing that captivated my attention more than any other definition, because I realized that when I lost my wife, I was still in love with her, but her love died with her, and I had nowhere to put this feeling, this emotion, and I didn't know what to do with it. And so that definition really captivated me. But just for generic terms, grief is basically the natural emotions from loss.
Okay, and do you have anything that you would like to add to that, Dr. Pitt?
No, I think that that's a really great explanation. It's really an emotion, and it's associated with loss, not just loss from death, but so many different kinds of losses are involved that can affect or give us that grief. But it's specifically in our case associated with the death of a spouse.
I'll be honest. When I first thought I was going to do this topic, I thought I was dealing with just death, just physical death. I didn't think of grief as losing a job, which I know it does impact people, but I just didn't think of grief as, you can grieve from losing a job on a massive level like that. I didn't think of course, I know relationships cause problems, but I didn't think that losing a relationship would come under this umbrella. And I have been told that even losing a house is tantamount to a death. So grief encompasses not just someone's physical death, it's losses. Whatever losses in life impact us greatly. And yes, Pastor Ford, I never heard that definition. That's a very deep definition. It really makes you understand possibly on a certain level of what people possibly might be having to deal with and go through. So thank you for that definition. And now beginning with Dr. Pitt, taking a look at the stages of grief, understanding that I've read that there can be 5, there can be 7, there can be different ones, understanding that I read that you don't always experience them in this way in which I'm about to, this order, and you can address that more. But I'm going to call out some that I read about, and if you all know of more, please let me know. So beginning with Dr. Pitt, pain and guilt.
Well, again, it depends on the relationship and what the loss is that you're experiencing. Of course, I'm dealing a lot more with the psychological part, the mind. And certainly there can be pain and guilt, but it doesn't have to be. I think that the more predominant losses or the emotions that I see is pretty much, it starts with denial, where it's like, I can't believe that it's happening to me. It happens to everybody else, but not me. This is ridiculous, and I think that is often the first one that I have seen. And even though someone's death, in my husband's case, he'd been sick for a while, even though it was imminent, I experienced that denial, like, no. This is not happening.
Mm.
So I think that those are the ones that I see first. Pain and guilt can come, I think, especially if the relationship was not a healthy one to begin with. But it's not one of the ones, especially from Kubler-Ross, and the way that she designs or signifies the losses that you're going to, or the emotions you're going to go through.
Okay, Pastor Ford, any comment on those two?
No, I think, as you have already alluded to, there are some proponents, should I say, of this sequential type of emotions. And we know that it just really doesn't happen like that. It's a ball of emotions that just kind of come out at different times and sometimes all together,
Mm.
and which is pretty overwhelming. But I think what Dr. Pitt was alluding to was the denial or the shock, so to speak, of, did this really happen? I know for me, my wife was really never sick a day in her life. And the shock of her just having cancer was difficult to even understand and to navigate through. But then, a few months later, she was dead. And so, which compounded the shock with um, all types of emotions, the pain, the anger, all of those particular emotions that we have. But I don't think that there is a predominant one. Everyone's, as Dr. Pitt alluded to, is depending on the relationship that you had with that loved one or with that loss. Certainly, it could be other things besides a loss of a person. But shock is, can't believe this is this really happening? Somebody pinched me hard because this must be a bad dream. And so the guilt can be, and I'm very much aware. I talk with people and have tried to help people deal with guilt, but most of the guilt really has been false guilt, where they said, if I feel guilty because I should have done this and I should have done that. But the word of God tells us that our times are in God's hands. And even before we lived one day, our times were already determined by God. And certainly we can do some things to hasten that, but our times are in God's hands. So a lot of times I really don't see true guilt, but I've seen false guilt. But I know that true guilt is out there, depending on if the relationship was bad. So
You said that it
understand.
was a short period. Your wife wasn't like sick for a long period of time or anything like that.
No, she was diagnosed with cancer in May of 2018, and she was gone July 24th of that same year of
Oh,
18.
goodness.
And so she didn't even show any signs that she was sick. When she was diagnosed, she had no signs. She was doing everything she had been doing. And then the first couple of weeks in June, she just deteriorated before my eyes very rapidly and quickly, which just, sent my head spinning and trying to figure out what to do. So yeah, that's how that happened.
Okay, and thank you for sharing that. The next one that I have is anger. The next two, anger and bargaining, Dr. Ford. What are your views on anger and bargaining?
Oh, it definitely is a part of my experience as a pastor, and having prayed and anointed people and seen God heal them. I just did not doubt that he was going to do that for me. And so when it didn't happen and she passed away, I was angry, very angry with God, and could not even pray. I was to a point where I couldn't even pray. And, you know, I had a friend of mine, a musician friend of mine, who had lost his wife, and he told me to take all of my feelings to God. He said, because there's no way that you're going to be able to navigate through this without him. And so, yeah, most definitely the anger. And what was the other one that you mentioned?
Bargaining.
Bargaining. Most definitely. I can say, even after 4 years, I found myself last week saying, God, just bring her back. My life would be so much easier if she was here. And I can see us being able to win souls to God because God has raised up this woman who was created. There's no way that no one could have done this except for God. And I can see all the souls being won and all the Bible studies that I could give as a result of that. And so the bargaining is a part of not accepting the fact that she is gone and not coming back. So that's very normal in this process.
Okay, Dr. Pitt, depression. What about depression?
Oh, yes, there will be lots of depression, perhaps not necessarily clinical depression, but you can expect that there's going to be a deep sadness. And just kind of a piggybacking a little bit on what Pastor Ford talked about with the anger. I just want to go back a little bit.
No
My
problem.
husband happened to have been ill almost when we got married. He was diagnosed with diabetes. So 43 years later, we had gone through a bout of just seeing how diabetes can rob a person of their health. So by the time he was ready, or by the time his death happened, he was at a point of, please don't take me back to the hospital. I don't want to go to the hospital. And I had the opportunity to grieve even before he died to some degree. However, after his death, it was different. And I didn't necessarily feel angry at God or anything, but out of the blue, sometimes I would just feel angry. And it was like nobody had made me angry, but there was just that anger that just seemed to want to just come out of nowhere. So again, so much of it depends on what are the circumstances associated with the death that can cause that. With the depression, again, you can expect that that's going to happen, because just like in the physical realm, if you've lost an arm or a leg, that's a part of your body that's gone, and you're going to have to make some changes and adapt to it. And in this realm of losing a spouse, truly, when God said the two become one, you have become one. And I know after losing my husband after 43 years of being married, it was like, oh my goodness, how do I keep on living without this piece of my being that I have depended on for so many years? So depression is going to happen. And I think that oftentimes we try to rush it. But one of the things that I have found with managing grief is that everybody's going to grieve at a different level and with different things that are going to be predominant in their journey to recovery. But depression is definitely something that I think everyone is going to experience.
And then going to Pastor Ford, what about acceptance?
That's I would have to say acceptance. You finally get to that place. I don't believe that I'm there. I think that acceptance is elusive, to say the least. You know, some days I feel like I've accepted it and I'm moving forward, and in other days I feel like, you know, what happened to my life, I can't believe. And so it's kind of in and out. But you do have to get to the place of acceptance so that you can move forward. I don't like the term that a lot of people use and say, you know, you got to move away. I think that you move forward, which means that you are taking something with you as you move forward. but I like what Dr. Pitt was saying about the fact that, and I've noticed this, that some people, when there's a long period of sickness and they know that it's imminent that the person will probably pass, a certain amount of grieving is done beforehand. And nobody likes to talk about that, because who wants to start grieving a person's death while they're still alive? And there can be some false guilt behind that as well. But there becomes a pattern, and I don't know if you're going to deal with this, but I think it's important, especially when you're a caretaker, that you have this routine. You know, you're getting meds, you're doing this, you're fixing food, you're doing these particular things. And then when the person dies, you no longer have that routine. And so there's a period of lostness that we feel, and even some guilt, some false guilt, because you start to feel relieved. Okay, I don't have to do this anymore. This, you realize, I lost so much weight, I wasn't even paying attention to my own self, but I felt relief. Okay, I don't have to go through this routine every day. And then I felt guilty because I felt relieved. And so it's like, it's a cycle that you have to navigate through. But the other thing that Dr. Pitt said, I think so important for everyone who has to go through grief, is to take your time. Sometimes we want to rush through it because we just don't want to hurt anymore. We want to go through. So I remember one guy said he went through the stages of grief in 2 months. And I was like, wow. But he was some type of statistician or something like that, where he's used to doing things quickly and working through the steps. But you can't do that with grief. And everybody's grief is different. And you have to allow grief to take you where it needs to take you so that you can heal.
It has been projected that there will be a grief pandemic in the United States, that because of all the deaths from COVID, and of course, every year we have deaths from so many other things, because of all the job losses, because of not being able to go to people's funerals and have that to say goodbye. Well, actually, let's back up, not going to the hospital and actually to be there with your loved ones while they are dying, and then not being able to come together and to have a funeral where families and friends, church members are able to come and cry and share and comfort. That these are traditions that we've had in society from the beginning of time when death started, possibly, I don't know. But it says that because we weren't able to do all these things, with all the politics, the hatred, the rage, the anger that has gone on during the pandemic, that there is going to be a grief pandemic in the United States. What can be done, Dr. Pitt, if anything, to stop this grief pandemic?
Wow, I don't know that I know of anything that can be done to stop it, because certainly there are so many people who have experienced loss and have not had the closure, have not been able, they dropped their loved ones at the hospital front door and that was it. And, you know, I am seeing several clients or patients that are really having a difficult time going through their loss because they never got to say goodbye in the normal kind of a way. As far as what can we do about it, I think everything goes back to have a relationship with Jesus. And as you recognize that, you know, Jesus is going to see you through whatever comes your way. Yes, he said it would be difficult, but if you are abiding in him, with all my clients, the bottom line is pointing them to Jesus as the one that can help them through the hurt.
Pastor Ford, sorry.
Yeah, that's very accurate. There's nothing that we can do to stop the pandemic of grief. Jesus said, in this world, we're going to have tribulation, but he said, be of good cheer, for I have overcome the world. And so we have to just trust him when we can't trace him. I think that's so important.